Okay, we've been sent a case here to evaluate for the use of implants for a maxillary overpartial, where we're going to use locators to avoid clasps here. Let's take a look at the implant plan. This case, as you can tell, it's an analog method. But I'd like to review why we're using analog. We're using analog because none of these teeth on the upper can be used to accurately or predictably stitch CEREC data to. So that makes it analog. My only critique in this particular case would be to have the lab utilize barium sulfate teeth, so the teeth show up much more crisp and clear on here. We do see the shadow of the teeth, but I'd like to see the teeth absolutely crisp and clear so that we can make sure that we see what we're doing. So let's go ahead and take a look at this plan for site number, let's call this number 9. My only concern here is the thinness of the buccal plate here, yet we have quite a bit of room here, so I would probably just go ahead and move this implant a little bit to the lingual and then tilt it a hair to the lingual there. Additionally, I also like to realize that, or keep in mind that my locator and then the housing for the locator attachment will be right here. So I don't want it close to the buccal area because that can thin out or make my area have to be thicker than it needs to be. So my preference would be to have that coming towards the lingual area of the flange. Now this will satisfy my need to have this away from the buccal plate and have my locator attachment back here so that it does not mess with the aesthetics of that tooth. And as we look at this one, again here, same thing. Right now we are coming out the middle of the tooth, and if this were a fixed restoration, that would be ideal. But in this particular case, I'm going to want to take this out the lingual cusp, just like so, for the reasons I mentioned earlier. Just the ability to make sure that my housing is here versus out here, so I don't have to have thick flange or mess with my tooth at all. So I prefer to have this right there. From an implant placement planning perspective, these are some of the things that I would do slightly different, and I would possibly consider going to a 4.3 in this particular one, simply because we have the space. And you never know if this may become a hybrid. And the other thing is I might place this a hair deeper to level out this particular spacing here for the future. So those would be my options and suggestions on this particular case. Thank you.